All right, so today we're going to do chapter 39, oxygenation. So, according to the SLO, by the end of this lecture, we'll be able to plan nursing care to administer medications to optimize oxygenation, examine the side effects, interactions, and nursing considerations for antitussives, and expectorants, mucolytics, and drugs for cystic fibrosis. Be sure that you know that for this chapter, it is chapter 39, but it is only those three things. Well, four things: antitussives, expectorants, mucolytics, and cystic fibrosis. Okay. No, nothing else. We don't need any kind of the inhalers, anything like that. We're just focusing on these things. Okay. All right. So antitussives. What is an antitussive? Stop. Tussive is cough. So antitussives, they help you stop coughing. So this is used, cough as a natural reflex to get things out, right? But this is when you have that awful itch in the back of your throat, or something is making you feel like you have to just continuously cough and cough and cough and you can't stop. Okay. So we don't use antitussives when we're coughing things up. We use antitussives when we can't sleep because we can't stop coughing. Does that make sense? So serves to forcibly remove the excess of secretions, and we've talked about what a cough is, okay? So the pharmacology of antitussives. So these are antitussives. There's different types. There's opioid antitussives, and then there's regular antitussives. So your antitussives are like the benzonatate or the Tessalon pearls. And then the opioid one, or promethazine DM, and then the opioid ones are the Vicodin or hydrocodone with some kind of antitussive. So the regular, we're going to talk a little bit on the next slide about what the antitussive is, but for the opioids, we have to remember this is a cough medicine with an opioid. So we still have to think about all the side effects that a normal opioid would have. So we monitor their LOC, we monitor their blood pressure, their respiratory rate, we monitor for constipation. Okay, so just because this is a opioid antitussive, it is still an opioid. So we still want to monitor all the same things that we would for morphine. Okay. When we're going to get into expectorants and mucolytics a little later. Okay. So dextromethorphan. This is the DM in everything. So anything over the counter that's like Phenergan DM, promethazine DM, Delsum DM, Mucinex DM. The DM is the dextromethorphan, and that is what is the antitussive, and it's going to help you stop coughing. Okay. So it can be PO, like a liquid, a tablet, a lozenge, a capsule, a liquid filled capsule. Okay, so all of the same nursing considerations for all those different types, remember. Okay. They use it for cold and flu. It suppresses the cough reflex in the medulla. Onset's pretty fast though, 15 to 30 minutes. Common side effects: dizziness, drowsiness, especially in your children. I felt like a lot of times when they have that DM, they sleep. And it could be because you're so tired and you're so sick of coughing that you finally get to sleep again. They can also, if you take too much, for sure, it can cause some GI upset. Okay, so which is like nausea, vomiting, diarrhea. Okay, in abuse situations, which happens, unfortunately. I see it, you see it a lot, unfortunately, that the people who they kind of abuse these kind of medications. So they can have it's got a lot of these have alcohol in them. Not like vodka or tequila, but it's still alcohol. And so people who have some kind of addiction sometimes take these medications because it makes it feel just like they're drinking vodka or tequila, whatever. Okay, so people do abuse them. Okay, that's why they're usually under like lock and key sometimes in the CVS. Okay, so it has alcohol. So CNS toxicity, you can have slurred speech, ataxia, hyperexcitability, stupor, which is the same thing as like when you have stupor, or when someone has stupor, it's kind of like they're very lethargic. Okay. Respiratory depression, seizure, coma, toxic psychosis. Basically the same things for alcohol, because that's what makes it in the abuse situations. They're drinking the whole bottle every day, and that's their thing. I just recently I was listening to a podcast, and that was his favorite drink, was Delsum DM. That's what he drank. And he was an alcoholic. He would do that and the vodka. Okay. So people do abuse it. So we do have to watch them. Drugs that you want to avoid, MAOIs, CNS depressants, alcohol. Don't drink grapefruit juice. I'm so sorry. And treatment overdose, there's no specific treatment. For contraindications, so chronic cough. If you have a chronic cough, this isn't going to help you. This is not what you need, okay? If you have asthma, don't need to take it either, because a lot of times when you cough with asthma, it's because it's your airway is constricting. So this isn't going to help you. This is not the deal, okay? Smoking, emphysema in children under 6 years of age. And so the smoking and emphysema and the asthma kind of all go together because it's usually something else going on, and we don't want you to mask the problem, and then we have other problems down the road, right? So biggest thing, avoid pulmonary irritants. Smoking, secondhand smoke. If you have like, especially if you're giving this to a child, if you're going home with one of the DMs and they're going home, if someone smokes in the house, they probably shouldn't do it. If someone vapes in the house, they shouldn't take this, okay? So in extreme situations, and if they're getting this in the hospital, we want to monitor their CNS, depression, and LOC. All right. So expectorants and mucolytics. So expectorants and mucolytics are very similar. Mucolytics liquefy secretions. So muco like mucus, okay, right? Lytics destroy like lysis. So it helps liquefy secretions. Expectorants liquefy secretions by increasing the respiratory fluid, and they help get it out, okay? So this is when you're coughing and you're hacking up that thick sputum or like snot, mucus, whatever it is, and you're having trouble clearing it. We'll give you an expectorant to help it thin out so that you can cough it up easier. We've all had a hacking cough, right? You've all heard someone have a hacking cough. They're coughing up something and you're like, man, they really can't get, it seems to be stuck right here. They can't get it out and spit it out, or they swallow it back down. Biggest mistake. Don't swallow it, okay? You want to get it out. That's the whole point. Your body wants to get it out. So if you can't pass it, if you can't get it up and out, we want to give you an expectorant or mucolytic so it can thin it, and then it's easier to cough up, okay? So helps loosen thick bronchial secretions, directly breaks down the mucus molecule. I just said all that, okay? So this does not help. This is not going to stop coughing. You are still going to cough, okay? Big deal. You are still going to cough, and we want you to cough. We want you to get all that junk out, okay? So guaifenesin, that's Mucinex, okay? That's the generic for Mucinex. So it's an expectorant. With the Mucinex, we need to make sure that they're increasing their fluids because that's how it works, right? It uses respiratory tract fluids to thin it. So if you don't have enough fluids in your body, it can't thin it, or it's going to take it and you're going to get dehydrated. So 8 ounces of water with each dose, okay? Biggest side effect is an upset stomach. Okay, we're gonna skip acetylcysteine and come back to that one. Dornase alpha is another one. So this one is a mucolytic, but once again, so it's going to thin the secretions, but it's not gonna draw from somewhere else. Still want to increase fluids, but not as important as the guaifenesin. The biggest side effect with the Dornase alpha is hoarseness or voice alterations. So like their voice sounds like hoarser or scratchier, and it's actually the medicine. It's not because you're getting sicker. Okay. Which is definitely something I would want to tell someone if you're going to take this home. You may get hoarse because I would think that means I'm getting worse and I've like damaged my vocal cords, but it's actually just the medication. Okay. And it does go back after you stop taking it. Okay, acetylcysteine, you probably remember this. They may have talked about it, in another semester, but it is a mucolytic. So the biggest side effect is vomiting, especially the aerosolized acetylcysteine. So I'm not sure if you've ever seen a breathing treatment given before. It's a simple mask, and it's got a reservoir at the bottom that you fill up with whatever the medication they have ordered, and it hooks up to oxygen or air. And so once the air comes through the tube, hits the medicine, it aerosolizes it, and we just put a simple mask so it kind of just stays here. So if you have someone that has a mask on, okay, and the biggest side effect is vomiting, they're gonna vomit right into that mask and then they're gonna probably choke. Okay, so have suction available, all right, especially if it's the aerosolized version, okay? Um, yeah, they also use acetylcysteine for Tylenol overdose. Okay. So when you use it for Tylenol overdose, it's usually IV. It's like a more continuous type of medication. If we use it for Tylenol overdose, the biggest thing we want to do with that, it's not going to be vomiting. It's going to be liver function, right? Because they're Tylenol. They just took too much Tylenol. So we want to make sure we're monitoring their liver function. We want to make sure we're monitoring their plasma levels of Tylenol and their plasma levels of the acetylcysteine, okay? Because that's what it's for. Other labs that you want to monitor with any of these, especially is like ABGs, okay, and your pulse ox, right? Because we want to be sure that we're not making it worse, making it better. We want to see an improvement, okay? Or if we're making it worse, we want to notice it so that we can fix it, okay? So these medications are used for cystic fibrosis, chronic bronchitis, or other diseases using thick mucus. That produce thick mucus. So this emphysema, the asthma that we were talking about with the antitussives, that's because they need the expectorants. They need to help get it out. So that's why they say don't use it with those and use it with this, okay? But that's really it. It's pretty short, simple, straight to the point. If you have any questions, please put them in the discussion board. Let me know. And good luck.